Did you know that some fruits, yes, fruits, could actually speed up aging, damage your brain, and raise your blood sugar more than a sugary soda? A 2023 report in the Journal of Clinical Nutrition revealed that adults over 65 who frequently consumed certain high-sugar fruits had a 57% greater risk of developing metabolic syndrome, a dangerous condition that increases the chances of stroke, heart failure, and type 2 diabetes. What's alarming is that many of these harmful fruits are promoted as healthy choices, especially for digestion and weight management, but they might be silently hurting your body every day. And if you're over 65, your slower metabolism, weaker cellular defenses, and lower sugar tolerance mean that the wrong fruit can accelerate damage quickly. The good news? Other fruits act like natural therapy, helping to lower blood pressure, protect your heart, and even sharpen your memory far beyond your biological age. In this video, we're breaking down the 4 best fruits seniors should eat daily and the 4 they should absolutely avoid. And make sure to stick around for the final fruit on the danger list. It's sweet, refreshing, and incredibly popular, but it may be silently draining your energy and cutting years off your life. Before we dive in, tell us in the comments where you're tuning in from, and don't forget to like this video, subscribe to our channel, and hit the bell for more videos like this. Now, let's get right into it. Fruit number 4, avocados. At number 4, we have avocados, and yes, they're technically a fruit. Far from the outdated belief that all fats are bad, avocados provide healthy fats that are essential for aging bodies. What makes them so powerful is their richness in monounsaturated fat, particularly oleic acid, which is known to lower harmful LDL cholesterol while raising beneficial HDL cholesterol. This shift in cholesterol levels is especially important for older adults, as it helps protect the heart and reduce the risk of stroke and heart attacks. But the benefits don't stop there. Many don't realize that avocados actually have more potassium than bananas, delivering close to 975 milligrams per fruit. This makes them excellent for regulating blood pressure, a critical factor considering that over 2/3 of seniors struggle with hypertension. Potassium naturally balances out sodium and helps relax blood vessels, allowing for smoother blood flow without relying solely on medication. In addition to heart and blood pressure support, avocados are a rich source of lutein, a plant-based antioxidant known to support eye health and slow the progression of age-related macular degeneration, which is one of the leading causes of vision loss in older adults. Even more impressive is how avocados enhance nutrient absorption. Fat-soluble vitamins like D, E, and K found in vegetables require fat for proper absorption. Including avocado in your meals can boost absorption of these nutrients by up to 15 times, helping you get more from your diet without needing excessive supplements. So, how much do you need? Just half an avocado a day can deliver these powerful benefits. Whether you spread it on whole grain toast, blend it into a smoothie, or simply eat it with a spoon and a bit of lemon, this creamy fruit is a simple, delicious way to elevate your health as you age. Fruit number 3, apples. Coming in at number 3, apples are one of the simplest yet most effective fruits you can eat every day, especially as you age. They're an excellent source of dietary fiber, particularly a kind called pectin, which acts as fuel for the beneficial bacteria in your digestive tract. This promotes gut health, which is key to strong immunity, better digestion, and improved absorption of nutrients, all of which tend to decline as we get older. But apples aren't just about digestion. Pectin also plays a major role in heart health by binding to excess cholesterol in your gut and helping to eliminate it from your system. Over time, this action helps to lower LDL cholesterol levels, supporting better cardiovascular health and reducing the risk of heart disease. Beyond that, apples are loaded with flavonoids like quercetin, which are powerful plant compounds known to reduce inflammation and promote healthy blood vessels and circulation. That's especially important for seniors who want to maintain brain and heart function. Worried about blood sugar? Despite their natural sweetness, Apples have a low glycemic load, and their fiber content helps slow the release of sugars into your bloodstream. This makes them ideal for people managing type 2 diabetes or insulin resistance by preventing sudden spikes and crashes in energy levels. Another overlooked benefit: apples are very filling thanks to their high fiber and water content, which can help curb overeating and support a healthy weight. Plus, chewing apples stimulates saliva production, which helps prevent gum disease and tooth decay, two common problems among older adults. Whether you prefer red, green, or yellow varieties, adding just one apple a day can have a big impact on your heart, gut, and immune health, making it a smart, tasty, and natural way to stay healthier with age. Fruit number 2, pomegranate. Taking the number 2 spot is the vibrant pomegranate, a fruit that often gets overlooked but deserves a daily place in your diet, especially as you age. While it may not be the first snack you reach for, this ruby-colored fruit is a powerhouse for cardiovascular health. As we get older, our arteries tend to stiffen, which can raise blood pressure, slow down circulation, and increase the workload on the heart. What makes pomegranate so valuable is its high concentration of punicalagins, a class of potent antioxidants known for their ability to reduce inflammation and oxidative stress in the blood vessels. Research published in the journal Atherosclerosis suggests these compounds may be 3 times more powerful than the antioxidants found in red wine or green tea. That's huge for maintaining arterial flexibility and keeping your heart pumping efficiently. Pomegranates don't just help your arteries, they can significantly impact your blood pressure too. Clinical studies have shown that regular pomegranate juice intake can lower systolic blood pressure by anywhere from 5 to 21% in adults with hypertension. This is especially important for older adults looking to manage blood pressure naturally without relying solely on medications. But the benefits go beyond the heart. Pomegranate also has powerful effects on brain function. In a notable study from UCLA, seniors who drank pomegranate juice daily scored higher on verbal memory tests compared to those who didn't. For anyone worried about cognitive decline, that's a compelling reason to make this fruit part of your routine. If chewing seeds is a challenge due to dental concerns, the juice offers nearly all the same benefits, especially when it's 100% pure with no added sugars. Even pomegranate supplements have shown promise, although eating the whole fruit gives you extra fiber and nutrients. The best part? You don't need a full glass of juice or an entire fruit each day. Just half a cup of seeds or a small splash of juice in your morning smoothie can make a significant difference. And because pomegranate has a low glycemic index, it won't cause major spikes in blood sugar, making it a smart option for seniors with prediabetes or type 2 diabetes. As with any antioxidant-rich food, if you're taking blood thinners, it's smart to check with your doctor first due to mild medication interactions. But overall, pomegranate is a delicious and science-backed way to support your heart, memory, and long-term vitality. Fruit number 1, berries. Coming in at number 1 on the list of must-have fruits for seniors are berries, especially blueberries, raspberries, and blackberries. These colorful fruits pack one of the most powerful health profiles available, particularly when it comes to aging-related conditions. What makes them stand out is their exceptional impact on both cognitive performance and brain protection. Berries are rich in anthocyanins, a type of plant-based antioxidant that gives them their deep hues and delivers potent anti-inflammatory effects. When consumed regularly, these compounds actively support brain health by reducing inflammation and enhancing signal transmission between neurons. In a major study published in the Annals of Neurology, older adults who ate just 2 servings of blueberries weekly experienced a noticeable slowdown in brain aging, equivalent to retaining the mental sharpness of someone 2.5 years younger. These cognitive benefits come from the berry's unique ability to cross the blood-brain barrier and counteract oxidative stress directly in the brain. But the advantages don't stop with memory. Research also shows that blueberries can enhance balance and coordination, which plays a huge role in reducing fall risk, a major concern for aging adults. On the cardiovascular side, Berries are just as impressive. Numerous studies have linked daily berry intake with lower blood pressure, better arterial elasticity, and reduced inflammation, factors that collectively reduce the risk of heart disease, still the number one cause of death among older adults. Berries also help keep blood sugar in check. Thanks to their natural fiber and plant compounds, they help regulate how sugar is absorbed, minimizing post-meal glucose spikes. This makes them an excellent choice for seniors managing diabetes or insulin resistance. In fact, 1 cup of berries offers around 8 grams of fiber, promoting better digestion and regularity without irritating sensitive systems. Adding just 1 cup a day, whether it's in a smoothie, on top of yogurt, or stirred into oatmeal, can noticeably boost your focus, energy, and mood. Just remember to choose fresh or frozen berries rather than dried ones, which often contain added sugars that diminish their health value. Now that we've covered the 4 fruits seniors should be eating daily, it's time to flip the script and look at the fruits older adults should absolutely avoid, starting with one that might be sitting in your kitchen right now. So, let's uncover the fruits seniors should actually avoid for better health and energy. Fruit number 4, grapes. Coming in at number 4 on the list of fruits seniors should avoid is grapes. While they may look like a light, refreshing snack and are often praised for their antioxidant content, especially the red and black varieties, grapes can be surprisingly problematic for older adults. The main issue lies in their high natural sugar content combined with very little fiber. Grapes contain fast-absorbing sugars like glucose and fructose, and because they're small and easy to eat by the handful, it's easy to overdo it without realizing. Just 1 cup of grapes has around 23 grams of sugar, about the same as a small candy bar. For seniors managing blood sugar levels, this can lead to serious issues. Since grapes offer almost no fiber to slow digestion, the sugars hit your bloodstream fast, causing sharp blood sugar spikes and insulin surges. Over time, these swings can lead to weight gain, chronic inflammation, and even a higher risk of type 2 diabetes. Another hidden concern is the pesticide residue that's commonly found on non-organic grapes. For older adults with weakened immune systems or sensitive digestion, this added chemical load can be especially risky. And while grape skins are edible, they contribute very little fiber or nutrients compared to hardier fruits like apples or pears. So even though they seem harmless, grapes can quickly become a blood sugar trap, and they're not the best choice for seniors aiming to maintain stable energy, healthy weight, and metabolic control. Fruit number 3, dried fruits. Taking the 3rd spot on fruit seniors should steer clear of is dried fruit, especially those preserved with sulfites. While they may seem like a natural and portable snack, dried fruits are actually one of the most misleading choices for older adults. The main issue? Highly concentrated sugar. When fruit is dried, its water content disappears, leaving behind a small but dense sugar bomb. A handful of dried apricots can contain just as much sugar as multiple fresh apricots, making it dangerously easy to eat too much fructose in one sitting without the fiber or water that would normally help you feel full. For seniors trying to manage blood sugar, even small servings of dried fruits can cause sharp glucose spikes. These sugar rushes can make conditions like type 2 diabetes harder to control or even increase the risk of developing it over time. But it doesn't stop at sugar. The inflammation caused by these spikes can also worsen joint pain, speed up memory decline, and impair immune function, all critical concerns for aging adults. To make things worse, many packaged dried fruits are treated with sulfites, chemicals used to preserve color and shelf life. These preservatives can trigger serious asthma-like reactions, especially in seniors who already deal with respiratory issues like COPD or age-related lung sensitivity. Roughly 1 in 100 people have sulfite sensitivity, but that risk rises in older adults with underlying breathing problems. When you combine the added chemicals with the excessive sugars, dried fruits become a poor choice for anyone managing inflammation, especially those with arthritis, which affects nearly half of adults over 65. Fruit number 2, unripe bananas. In the number 2 spot of fruits to avoid, unripe bananas, those firm, green ones, may look harmless, but they can spell trouble for older adults. While ripe bananas with brown spots are generally safe and nutritious, their unripe versions bring several health drawbacks that can outweigh any benefits for seniors. The biggest concern? Resistant starch. Unlike the natural sugars found in ripe bananas, the starch in green bananas is harder to digest. This is especially problematic for seniors who often face slower digestion and reduced enzyme production due to aging. That resistant starch tends to ferment in the gut, leading to uncomfortable side effects like bloating, gas, and stomach cramps. For older adults with IBS or inflammatory bowel issues, which become more common with age, these effects can be even more intense. But beyond the discomfort, undigested starch can actually interfere with your body's ability to absorb nutrients from other foods eaten during the same meal. That's a serious concern for seniors already dealing with low appetite, medication side effects, or age-related nutrient absorption decline. On top of that, green bananas contain astringent compounds, the same ones that cause that chalky, dry mouth feel, which can irritate the lining of the digestive tract, potentially triggering inflammation in sensitive individuals. To make matters worse, unripe bananas offer far fewer antioxidants than ripe ones. Antioxidants build up as the banana ripens, so by eating a green banana, you miss out on many of the anti-inflammatory benefits that make fruit so valuable in the senior diet. For anyone looking to support healthy aging, unripe bananas simply fall short. Fruit number 1, grapefruit. At the very top of our list of fruit seniors should steer clear of is grapefruit, a fruit often mistaken for being a safe, healthy choice. While grapefruit has long been associated with weight loss and heart health, it carries a serious hidden risk for older adults, especially those on prescription medications. The core issue comes down to a group of natural compounds in grapefruit known as furanocoumarins. These compounds interfere with a crucial intestinal enzyme called CYP3A4, which helps break down nearly 85 common medications. When this enzyme is blocked, your body can't metabolize those drugs correctly, causing dangerously high concentrations in your bloodstream, even if you're taking your meds exactly as prescribed. That means a normal dose of medication can behave like an overdose, leading to severe side effects or complications. This interaction is especially dangerous for seniors who are more likely to be on drugs that are directly affected. These include widely used cholesterol medications like atorvastatin or levastatin, blood pressure drugs like calcium channel blockers, anti-anxiety meds, antiarrhythmics, immune suppressants, and even certain antihistamines. For instance, drinking grapefruit juice while taking Lipitor can increase the medication's levels in your blood by over 400%, which could lead to muscle damage, liver stress, or kidney failure. And here's the kicker. You don't need to consume much. Even half a grapefruit or a small glass of juice can trigger the interaction, and the effects can linger for up to 3 days, meaning spacing your intake won't help. Given how many seniors rely on these medications daily, the risk isn't just theoretical, it's real. That's why grapefruit tops the list of fruits to avoid if you're over 60 and taking prescriptions. Before adding it to your diet, always check with your doctor or pharmacist to make sure it won't interact with your medications. Grapefruit may seem like a smart snack, but for many seniors, it's a hidden hazard that can seriously jeopardize their health. Final thoughts: the fruits helping and hurting senior health. And there it is, your full guide to the fruits seniors should lean into and the ones better left behind. The right fruits like avocados, apples, berries, and pomegranates can support graceful aging, improve mental clarity, and boost daily strength. On the flip side, fruits like grapefruit, dried fruits, unripe bananas, and even those sweet little grapes can quietly trigger issues like inflammation, blood sugar spikes, and digestive trouble that chip away at your well-being. What makes this especially tricky is how sneaky these effects are. You might think a handful of dried apricots or a few green banana slices are harmless, Yet they could be setting off a wave of internal stress that doesn't show symptoms until it's already done damage. So be selective. Eat with intention. And when possible, balance your fruit with a source of healthy fat or protein to soften any sugar spikes. Now we want to hear from you. Were you surprised to learn some of these healthy fruits might be causing harm? Have you ever felt off after eating a certain fruit without knowing why? Drop your thoughts, experiences, or questions in the comments below. We love hearing your stories. Thanks for watching, and don't forget to like, subscribe, and share this with someone who might need it.